On the impact of the second wave of coronavirus in the province. Let's take you straight there now.
On the effect of this pandemic, let me extend our greetings to MEC for Economic Development, Tourism and Environmental Affairs, Honorable Pillay, MEC for Health in KwaZulu-Natal, Honorable Ms. Nomakuku Masmilane Zulu, government officials who are here led by Mr. Mabaso, of course members of the media, compatriots and all. We welcome you to this media briefing, which mark our first gathering since our health minister, Dr. Zweli Mkhize, officially announced the arrival of the second wave of COVID-19 infection on the 9th of December 2020. We wish to start by registering our shock and sadness at the passing of Umlala's mayor, Councillor Jege Zulu, who passed away yesterday after an illness. Councillor Zulu was a respected local government leader with unmatched work ethics and a sheer determination to change people's lives for the better. He had a profound understanding of the direct and the immediate impact that local government can have on people, and made it a great priority to ensure that government serves the people and not the other way around. We say that may his soul rest in peace, and may his family, friends, and all those who know him be comforted and find strength at this trying time. With regard to the second wave in KwaZulu-Natal, this briefing comes in the midst of December festive holiday, which is like no other in our living memory. Traditionally, by now we would have been in full celebratory mood, ready to bond with our families, but this year's festive season feels different to what we have previously been accustomed to. The COVID-19 pandemic has changed many aspects of our life, and the important new habit we have formed must shape our behavior over the festive season. Celebrating life and protecting the lives of those around us will be a major gift that we can give to each other during this festive season. We find ourselves confronted by a resurgence of COVID-19 in our country and in the province. Indeed, the second wave that we were warned about for the past few months is here, and it is proving to be more deadly than we thought. In recent days, we have found ourselves increasingly in mourning. This is a stark reminder that COVID-19 is not on holiday. It is in fact back, and it's very, very dangerous. Many people now know at least a few people who have passed away due to COVID-19, which is a cause of major concern and a bitter pill to swallow. What this means is that we need to embrace our new normal, whereby all our actions are informed by needs to protect ourselves from acquiring and spreading COVID-19 to others. This therefore means that it is not negotiable for us to adapt and adopt new ways of doing things in order to stay safe from the virus. A few minutes ago, we concluded the road safety campaign known as Hood for Life, Arrive Alive, as well as monitoring and inspections of various areas and public amenities for compliance with COVID-19 regulations by our citizens and various establishments. This campaign, which we undertook with the Minister of Transport, Honorable Mbalula, and our MECs, has given us a first-hand impression of whether our citizens are heeding the warnings about the second wave or not. We must express our satisfaction with the level of COVID-19 compliance by many establishments and outlets. Deeply concerning, though, is the behavior of some individuals. There is a high level of non-compliance with proper wearing of masks, which seems to be influenced in most cases by alcohol consumption and a high appetite for gatherings, especially in areas of entertainment that pose a high risk of being super spreaders, including the beaches. We've also noted footages depicting scenes of overcrowding at beaches and failure to wear masks by people who are swimming who are swimming in rivers and elsewhere. We wish to remind citizens to conduct themselves responsibly. The wearing of masks is compulsory, and adhering to social distance is an absolute necessity. So is the need to respect the 11 p.m. to 4 a.m. cafe that has been put in place by the President. Those who intend or who are floating the safety regulations are being warned that we are going to take serious actions. We have resolved to intensify our monitoring efforts and get the law enforcement to effect arrest where warranted. We have intensified law enforcement. To this effect, from the 1st to the 18th of December, a total of 14,589 vehicles were stopped and inspected by our traffic officers. As a result, a total of 56 vehicles were suspended and 130 unlicensed vehicles were discovered. In terms of fatalities, since the 1st to the 19th of December, the province has recorded 130 fatalities. This is lower than the 159 fatalities recorded during the same period last year. With regard to compliance with liquor trading laws, the KwaZulu-Natal Liquor Authority, which is an entity operating under MEC Pillay in the Department of Economic Development, Tourism and Environmental Affairs, working together with SABC as well as various municipalities, will now be increasing bleeds at various high-risk areas across the province. To date, we have undertaken a total of 44 joint law enforcement operations led by SABC and the KZN Liquor authorities. During this time, 24 liquor licenses were suspended, while 13 more suspensions are in a process of being finalized. The Liquor Authority has also noticed a surge in fraudulent liquor licenses and has doubled effort to clamp down on these. For an example, in the last 3 months, 12 fraudulent licenses were uncovered by the SABC. More operations will be conducted in this regard during the festive season. The province of KwaZulu-Natal, when it comes to COVID-19 trend and analysis, the province ranks as the 4th biggest contributor countrywide in terms of laboratory confirmed cases and has observed a substantial increase in the number of new cases in the past 2 weeks. We are currently in week 51 of 2020. For week 50, the actual number of confirmed cases was 9,857, while for week 51, the number is now standing at 10,194. This marks a 4% increase of infection between week 50 and week 51. Over the past week, The highest number of cases received was 2,912, and that was on Saturday, the 1st of December, while the average number of cases recorded daily was 2,165 cases per day. In terms of the district, eThekwini district has continued to record the highest number of new cases daily and contribute approximately half of the total laboratory confirmed cases provincially. The 5 districts that are hardest hit by COVID-19 second wave in the province are as follows. It's eThekwini, which is now having 66% of new cases. It is followed by Ilembe. Ilembe has 5.5%, Umgungundlovu 4.2%, Ugu 9.9%, Hirigwala 1.7%. If you take this into numbers, it will then tell you that eThekwini, the new cases are 1,625. Ilembe, new cases is 1,033. Umgungundlovu, it's 103. Ugu, 242. And Hirigwala is 42. In terms of deaths, we are concerned at the fact that the province is experiencing an increase in the number of COVID-19 related deaths reported daily. The actual number of deaths which occurred in the week 50 was 68, and for week 51 it was 111. The average number of COVID deaths recorded daily in the past 2 weeks was 13. It tells you that we are facing a serious challenge. If on daily basis at least 13 people will pass away because of this pandemic, and this is very, very serious. So the case fatality rate for the province was at 2.4%, while the mortality rate was at 32 deaths per 100,000 population. With regard to home deaths, the province has also experienced an increase in the number of home deaths. On the 17th of December, the province received 22 home deaths. This means that the province now has 142, or rather 3% of deaths that occur at home since the beginning of the pandemic. We send our deepest condolences to all families of the dearly departed. With regard to the positivity rate, the number of cases testing positive in the past 2 weeks increased from 15% to 24.5%. Infection among healthcare workers, a total of 7,891 healthcare workers have been infected with COVID-19 in the public sector since the beginning of the pandemic. Of the total infected, 91 sadly succumbed to this disease, and that 91 represent 1%. The majority of the infected healthcare workers were nurses, and that represents 56%, and others 56%. The number of infected healthcare workers has increased by 449, which is 6% in the past 7 days. In terms of recoveries, the overall proportion of recoveries for the province continues to decline and is at 82%. The decline is consistent with an increase in the number of new cases and the incidence risk. In terms of the strain, as per the announcement by Health Minister, Minister Zweli Mkhize, a new variant strain of COVID-19 has been discovered in the 3 provinces, including KwaZulu-Natal. The clinicians are currently undertaking more studies to establish if this new variant does change the cause of the disease. We are, however, deeply concerned at the rate of infection and the increased numbers of deaths. This calls for all of us to sit up, take note, and change how we do things. With regard to the bed capacity, the province has developed a resurgence plan for a festive holiday as well. Both of these, which is the resurgence plan and the festive plan, are based on the experiences we went through during the first wave of the COVID-19. At the cornerstone of these plans is the health education, isolation, quarantine, and contact tracing. We are focusing on encouraging fellow compatriots to wear their mask, wash their hands frequently with soap and water or alcohol-based hand sanitizer, and practice social distancing. We have suspended major events, and we are clamping down on non-compliance with regulations. We are planning to shut down and effect arrest on those organizing super spreader events. We therefore appeal to the public to avoid attending super spreader events, as they have proven to increase the transmission of the virus. There is no time to fool ourselves. We are shedding enough tears already, and we will request our people and all members of the society to cooperate with us. We also want to dispel the notion that our healthcare facilities are beginning to succumb. Yes, the healthcare facilities are experiencing a high demand, but the system has not succumbed due to pressure. It is up and it is functioning. We have enough capacity. The department has prepared a total of more than 3,000 beds in public health facilities in response to the second wave. Out of these 3,000 or more beds, we have also those that are for ICU that are also prepared. We once again appeal for people to stop spreading fake news and create unnecessary public apprehension. The government will remain open and transparent with citizens at all times. With regard to the staff capacity, our efforts remain fortified by the presence of staff who were employed for the COVID-19 first wave. We are happy that their contracts have been extended so that they can assist us to respond adequately to the second wave. The province has recorded a number of cluster in the healthcare settings, church gathering, retail shops, funerals, ceremonies, and parties. And cluster infections are all over. The recent cluster outbreak in gatherings have proven to be fatal and to be very, very challenging, as it has been proven that in one of these mass gatherings that took place in Assisi COVID in Uku, about 6 nurses passed on. But that was also followed by the cluster outbreak of KwaZulu-Natal under Umzinyati district. We are told that about 2,000 people attended. And I wish to repeat this, more than 2,000 people attended this event. It is unthinkable, and no one can imagine such a thing happening in the current environment. It is hardly surprising that at least 48 of the attendees have already tested positive. We once again wish to issue a warning to all our fellow compatriots that we are now confronted by a dangerous outbreak of COVID-19 in KwaZulu-Natal. We appeal that everyone acts responsibly. With regard to admission and isolation, As of the 18th December 2020, a total of 717 patients were admitted for COVID-19 and 1,274 were admitted as persons under investigation in public health facilities. As of the 18th December, the private hospitals in the province had 1,506 patients admitted, with the majority being in eThekwini, and that is 1,008. The department has a total of 775 ventilators and 915 non-invasive ventilators. Some hospitals in the private sector have been under pressure in terms of bed availability, but the department has prepared enough beds. The situation is being reviewed on a daily basis, and additional beds will be made available if a need arises. The department has not activated beds in the private sector facilities for patients under investigation, but will do so if the need arises. The current turnaround time for the analysis of COVID-19 tests with the National Health Laboratory Services is now 72 hours. We continue with tracing program. The department is implementing a number of strategies in dealing with contact tracing, and such strategies include the following: the targeted screening and testing of contact in areas that are deemed hotspots, the activation of district call centers to do telephone monitoring of contact, and the activation of additional contact tracing teams. With regard to the impact on the economy, especially tourism, we expect that about a 69% decline in the domestic tourism will take place in 2020 compared to 2019. This represents about 2.3 million trips in 2020 versus the 6.2 million trips recorded in 2019. The estimate spend will be about 3.6 billion compared to 8 billion in the previous year. The tourism sector is expected to recover to 2019 levels at about 2022 or 2023. That is just the forecast. For the 2020 festive season, which is December 2020 to January 2021, we are forecasting that we will receive between 600,000 to 750,000 domestic visitors. In 2019, there were about 815,000 domestic visitors for both December and January. Following the announcement of more restrictions, including the closure of beaches and public parks on certain days, a survey was conducted on 144 accommodation establishments across the province. This was to establish the impact of the announcement on the tourism and hospitality sectors. Of those interviewed, 59% establishment reported to have received cancellation for the festive season period. In terms of occupancy, it must be reported that the occupancy rate is varying, with some cancelling, and some of cancellation were due to anti-travel anxiety due to the increase of COVID-19 numbers. And the occupancy in our establishment in eThekwini, we have projected 25% reduction in occupancy rate from what was 70% to 55%. Ilembe, 20% reduction. Ugu, it's at 80%. Currently, Ugu, it's at 80%, and that is good. Umgungundlovu, the occupancy rate is between 45 to 50%. Umkhanyakude is fully booked and was not affected by beach restrictions and all of that. Zululand was sitting at 45% in terms of occupancy rate. Amajuba between 45 to 50%. Drakensberg establishments in Uthugela have reported 100% occupancy for this week until the 5th of January. So it moves us that the occupancy rate is not that bad. It has moved from 80%, but we would want to ensure that in all areas we continue to monitor the situation. In establishments like Battlefield, they are at 80%. Ezemvelo is projecting a 5% drop in their own establishment, and that will be a decline from 42% to 37%. The KwaZulu-Natal is, however, the KwaZulu-Natal government is, however, in full support of the latest restrictions as announced by the President, His Excellency President Cyril Ramaphosa, recently. We believe that these restrictions strike a healthy balance between our numbers and our priorities of saving lives, but at the same time, preserve the need to stimulate the economic activity. The Department of Economic Development, Tourism and Environmental Affairs, working with other departments such as the Department of Labor and the SABC, have been conducting inspections at various businesses in the province. Businesses that have been inspected for compliance with COVID-19 restrictions include supermarkets, factories, gym facilities, and banks. These spot checks will be done continuously as we still continue with the implementation of restrictions. We will not hesitate to take actions against those who are found to be floating the rules. And in this regard, we are emphatic. Let us strike a balance between protection of the people and the lives and the economy. We wish to make a renewed call to the public to partner with us as government as we try our utmost to navigate our way out of this deadly second wave of COVID-19. The only way that we will make it out of this situation will be through taking personal ownership of the responsibility that we all have, which is to avoid acquiring and or transmitting the virus to others. It is individuals that transport and help the virus to travel to others. The success we have made in the first wave can easily become our failure. The worst has not passed. It is with us. But we now have more information and more knowledge about this virus than before. What we see as the challenge or a key question is whether are we disciplined enough to adhere to the warnings that will save our lives and the lives of those of our loved ones. We ask our pastors, traditional leaders, mayors, councillors, community leaders, and every citizen to play their part and prohibit activities that may be super spreaders. And we would want to cooperate, and we wish to appeal to our religious leaders, because some have taken an approach that borders on trying to say the virus is not going to be impactful. We wish to plead to all of them. Let us once again come together, cooperate, and work our way through this challenging moment. We can do it. Making a difference start with you and I. Each and every one of us must play her or his role. I thank you, Mr. Mabaso.
Thank you very much, Honourable Premier. We go straight to the Executive Authority and that's the police, the House, the Executive Authority.
Daisy from the SABC. This question is directed to the Minister of Health and Local COVID-19. The second wave of COVID-19 has taken lives of several sisters, nuns, congregations, and daughters in guidance of Fort Shepson. They all died within a week. Reportedly, 15 other nuns are also gravely ill. What support will be given to the religious sector, and is there concern as we fast approaching Christmas? Thank you.
Thank you. Hi, for Michael Lanya from New Zealand, Africa. Premier, let me start with you. I'm watching a bit late, but you were talking about stats and how the recovery of the economy of KZN and how you're confident in that. Is that going to be on par what we've seen in the past, or will you be adapting to the new normal that KZN has put, so that COVID-19 has put the whole country? So when you're talking about recovery, those types of, are you adjusting those numbers, taking cognizance what COVID-19 has caused? And for you, NEC, for health, the health system is already very burdened. So when we have a new variant of this virus, is there any concern that bed space and also hospitalizations might increase? Because even though the government says don't panic, but are you making preparations just in case we see numbers spiking again of hospitalizations and deaths connected to this new variant? Thank you.
Thank you. No one is well. Can we hand over to your argument?
Thank you. I think it will be better if I allow MECs. Yeah, because there is a MEC for economic development and MEC for health. So they will take these questions. If there is a need to add, I will come back.
Good afternoon, ladies and gentlemen. We only have two questions. The first one is in relation to the sisters that were affected, and I think we need to firstly pass our condolences to the families, to the church itself. The report that the Premier has read and given to us was indicating that this is as a result of a gathering that was held at that particular church. As a result, you will find that in the reporting, the reports in the media are actually saying it's Marian Hill Convent, but it's actually one group, because that is how they name their districts. So it is between Marian Hill and Uku district itself. What support are we providing to the religious sector? We have been having continuous engagements with the religious sectors through the Office of the Premier. I think the last one we had about 2 months ago, and the kind of education that is needed and so forth, and we are going to continue with that. There has been requests in this particular instance from the Catholic Church to say, could they be provided with sanitizers and masks and so forth. We will be looking into that. But there's also an element that speaks to the Social Development Department, and the DSD, I think, was informed by the Office of the Premier as well to get in and see what kind of assistance they can provide. Having said that, we are calling on all the religious organizations, the churches, all the centers to be aware that yes, we had our peak around July, August, and we went through it, but we are now faced with a new situation. We might be on level 1 lockdown. However, the circumstances that we are faced with are pushing us to ensure that we reduce the number of people that we have, or the number of people that actually engage are in one room at any given time. When the President made an announcement last week, he indicated that in-house, we are looking at having, I think it's 100 people as a limit, but outdoor it's 250. While that is a guide that we cannot go beyond, as a Department of Health, in reality, we are calling on people to avoid gathering, because sometimes it becomes very difficult to actually separate the people from each other, particularly when we are attending church gatherings. We are singing, we sing next to each other. It becomes really impossible to be practical with the with the protocols. It's probably not even possible to sing with your mask on. I've not tried it because I'm not very good at singing, but I think it's a bit difficult because it's difficult for me to speak to you right now because you won't be able to hear me. So what we are calling on and requesting our religious leaders to actually be vigilant on and work on is try to reduce them numbers as much as possible. If we can avoid gatherings, let's do so. If we can have gatherings virtually, as we have started over the year, we encourage that so that we avoid the contacts as much as possible. You will know, well, you probably don't, but in the last week or so, there was a report in the social media of 3 elderly sisters who are siblings. They go to the same church. There was a church engagement in